we're looking at the business of beauty. According to Professional Beauty 2012, since the end of the 90s, the global market for cosmetic surgery has increased annually by between 10 to 15%. And earlier, I caught up with Anushka Reddy, aesthetic physician at Medi-Sculpt clinic, and asked her if South Africa was exhibiting similar trends.
It's very much the same in South Africa as it is in the rest of the world. But I think just at the outset, I just want to explain the difference between cosmetic surgery and cosmetic medicine. You know, when we talk about surgery, we're talking about cutting, we're talking about invasive procedures involving anesthesia, downtime, and obviously a very high cost factor. When we talk about cosmetic procedures, these are non-invasive procedures. We are talking about things like Botox, dermal fillers, liquid facelifts, and the latest thing called the 3D vector lift. Now, there's a big difference simply because although cosmetic surgery per se has increased, but if you compare the two, if you compare cosmetic surgery to cosmetic medicine, cosmetic medical procedures has far exceeded cosmetic surgical procedures. And the main reason for that obviously are, you know, people these days have very busy lifestyles. You know, we don't have the luxury of having taking 2 weeks and you know, taking off 2 weeks at our houses, you know, for the healing process to take place. Also, you know, no one wants the risk of anesthesia. You know, there's risks associated with these procedures. And I think the other important thing also is that with cosmetic surgical procedures, these have permanent results. You know, you've probably seen horror stories and read about them. You know, women go for these facelifts and they have totally different looks. So with cosmetic medical procedures using Botox and fillers, because they're not permanent, they're temporary, we're having a much more natural result.
Okay, so we've got to break it down into those two categories and make that distinction. What facet within the categories as a whole is actually raking in the big business, and what target market are you looking at?
But I would say Botox at the moment is very much I think the largest segment in the aesthetic market that's growing. If you look at it year on year, sales for Allergan, you know, that's the company that makes Botox, has increased by at least 20%. And, you know, so it's a multi-billion-dollar industry at the moment. What we have seen change over the last few years is that we're certainly seeing more men have these procedures. And for a simple reason being that men who are 60 and 65 are working. You know, no one is thinking of that as the retirement age anymore. So they're looking at themselves in the mirror and they're saying, oh, I've got the 65-year-old look, but I feel like a 40-year-old, you know. They're in the boardroom, they're up against these young bucks, you know, who have just finished, you know, university, and they don't want to portray this old person look. So they come to have these type of procedures done. In their lunch hour, you know, they can have a quick jab, and they're off.
So looking the part to be part of that workforce and remaining relevant as well. It seems that there's a lot of money to be made when it comes to the business of beauty. What's your assessment of the competitive landscape out there and the supply-demand dynamic that's currently at play? Because you're talking about increasing demand. How's that supply managing up?
Well, specifically in South Africa, I think the market, especially amongst doctors, it's growing rapidly. I mean, compared to, if I have to look at the way it was 10 years ago as compared to now, I mean, you know, it's almost every other GP and every other dentist is offering this type of service. And that's because obviously there's a demand for this. So I must tell you, you know, the other day I spoke about trends, aesthetic trends for 2012. And I think because of this trend, because we're having more doctors do these type of procedures, I won't say they're not adequately qualified, but because they are starting to do these procedures, we are going to see more problems with these type of procedures coming, you know, through.
Problems like?
Like, you know, if they don't quite understand, I'm talking about now non-invasive procedures, so if they don't quite understand the mechanics of Botox, it's very easy to get a droopy eyelid or a skew mouth. You know, and that's what we're going to see. You know, more and more people are going to be complaining of this, these type of side effects. But thankfully, these are not permanent, eh?
Absolutely. Well, thankfully, because let's take a look at the medical tourism market in South Africa. It seems to be ramping up. To what extent are we on the radar screen for foreigners out there tapping into our market for these kind of procedures?
You know, South African doctors, as you may very well know, are rated as some of the top you know, in the world, top physicians in the world. But 10 years ago, yes, it was a booming industry. You know, we used to call it surgery and safari. Lots of foreign people, British people coming through to South Africa and Americans to have these procedures done. Now, I must admit, these procedures are becoming more expensive. You know, if you had to compare a breast augmentation in the States compared to South Africa, yes, the States would be a little more expensive. In the UK, it is significantly more expensive, but that's because of the exchange rate, I suppose, more than anything else. So South Africa, we're sort of fading on that in that sphere. The East, surprisingly, has, you know, gained that population of people who are actually looking to have these types of surgery, you know. So people who want to have breast augmentation done outside their country will probably end up in Thailand.
So it's becoming more expensive even for the foreigner, where, you know, they've got the weaker rand at their advantage. What's the affordability looking like for locals in South Africa?
Relative to other countries, South Africa is still a little bit cheaper. So if you have to look, if I have to give you figures, if you have to look at doing a breast augmentation procedure in South Africa with a reputable surgeon, you'd look at paying anything between 25 to 35,000. A similar procedure in the States would cost anywhere between 35 to say 45,000. Okay, so can you see it's marginally cheaper in South Africa.
So what kind of growth do you foresee moving forward, and to what extent does the rest of Africa form part of the target market, looking at the rate of growth that we're seeing in the African consumer, broadly speaking?
You know, and that's the other trend, I think, that we're noticing in aesthetic procedures, is that besides the more complications, as I spoke about earlier on, we're seeing a more diverse population group having these procedures done. A couple of years ago, it was only seen for white skins, you know, people... And that makes sense, because white skins do age more. You know, they lack pigment in their skins, they're more prone to sun damage, so they will age more. So they were having these procedures done more often. But surprisingly, you know, people of ethnic backgrounds are now having these procedures done. And I think a large part of that is actually more education. Yes, so a woman in her 40s of Asian descent may not have it done, but by the time she's in her mid-50s, she would certainly have these things done.